So once you're diagnosed with cancer, one of the first questions you ask is, what does this mean for me? And this translates, in my mind, to two questions. What's the extent of the cancer? And then what can we expect at the outcome of the treatments? And something called staging helps me answer those questions. Staging is what allows us as doctors to classify cancer and to recommend treatments. We understand staging by understanding where the cancer is. We understand staging by understanding where the cancer is. So for example, if it's breast cancer, is the cancer confined to the breast? Is it only one area of the breast or more than one area of the breast? If it's lung cancer, same question. Is it only in the one lung? How big is it? Is it in other areas of the lung? Same or the other lung? Another part of the equation is, has it spread to any of the surrounding tissue or the lymph nodes? Or has it spread to other organs like the liver, the bone, the brain? And depending on what the cancer is, where this cancer started, we would recommend different testing such as the CAT scan or MRI, or sometimes even something called a PET scan, to understand the extent or the staging of the cancer. For some cancers such as lymphoma, we may actually have to do a biopsy, such as a bone marrow biopsy, to answer that question fully. Once we understand based on this testing what the staging of the cancer is, we can then talk about what the treatments should be. And there are some national guidelines that help us as oncologists, but also as you as a patient family, to understand what to expect and what the treatments are and should be. The treatments are generally defined as those treatments that work locally in the area where the cancer is. For example, surgery. Surgery only works where we open or cut the organ up and remove something. Radiation or X-ray beams directed therapy is also something considered local therapy. It only works where we aim it. Chemotherapy is another modality that is available to us. It's either given intravenously or by mouth, and it goes throughout the body. And we use one or more of this combination of therapies to ideally treat the cancer. So once we have understood what the extent or the stage of the cancer is, we've understood what the treatments are recommended. The question is, what's the goal? Why are we doing the treatments? And this is a question that everyone should ask and get a good answer to. And in my mind, there are only two ideal answers. One, our goal is to cure, which means to remove or eradicate the cancer so it doesn't come back. And if that's not feasible, the goal is to control the cancer so that it doesn't cause a symptom, or if it delays the symptoms from the cancer. So those are the essentials of what the staging is, what the extent of the cancer is, what the treatments are advised, and what the ideal outcome should be.